recognized as one of the nation's leading healthcare podcasts, you're listening to Spend Less on Healthcare with Dr. Josh Luke, where you'll get simple tips to reduce the amount of money you and your family spend on healthcare. Hosted by longtime hospital CEO, healthcare futurist, three-time Amazon #1 best-selling author, corporate coach, and sought-after keynote speaker, Dr. Josh Luke, he and guests teach you how to keep more money in your pocket and live healthier. Take a seat in Dr. Luke's waiting room.
Hey folks, before we jump into the next segment of the show, I want to make sure you know how to request further information from me or from the show or whatever it is you're looking for. And the best way to do that, we've really simplified it for you, is just to text the word Josh, my first name, Josh, to 72,000. That's 72000. In fact, when you text the show, you'll not only receive our free gift, which is 10 tips to start saving on healthcare today. You'll receive it right away. But you'll also receive promo codes for some of the other products and services we offer you to learn how to spend less on healthcare for you and your family. So that's text the word Josh to 72000 and get your 10 tips list at no charge today. Thanks so much. Text me. Your spend less on healthcare tip of the day for this show, folks, is to go on to healthy.com and register for free funds for your healthcare bills with no strings attached. That's right. It's HLTHE.com. It is simply free money with no strings attached. Once you get to that website, you register for a wallet, an online wallet, which takes all of about 2 minutes to give your name, email, and phone. In a couple of weeks, you'll get a prepaid debit card in the mail, at which point you can start loading free money from different companies and individuals who donate money through the healthy.com technology. If you are somebody who is in position for a company or family to donate money to help those in need, you can make a tax-free donation, which is what makes healthy.com different from GoFundMe. So check it out at healthy.com. You can find out about their technology and how they partner with not-for-profits to help you pay your healthcare bills and medical bills that you can't afford. Your 1-minute tip for today on this show on how to save money for you and your family on healthcare is to go to HLTHE.com and register for a wallet and start getting free money today. Hey folks, Dr. Josh Luke here, and we have once again renamed and rebranded the podcast, and this will be our first ever episode of the new podcast called Spend Less on Healthcare with Dr. Josh Luke. I wanted to make sure, even though we've had the logo and stuff set up for a couple weeks, that we had the right guest, because our new focus, guys, is going to be largely on healthcare affordability for individuals and American families. We've done a really good job of covering healthcare affordability for corporations, about healthcare transformation, all those things. We're still going to get into those things, but we want to really be a podcast for the American family, whether the mom, the dad, the single person, to just say, man, I spend too much on healthcare and I'm a healthy person. So here's some tips on how to save money. And so my first guest is somebody I met at an event a couple weeks ago who's just really impressive, works for a very impressive organization, has a really impressive personal track record as well. Help me welcome to the show Nurse Kelly Johnson from Wanderley. Welcome, Kelly.
Well, thank you so much for having me. It's my pleasure. I can't wait.
Yeah, I'm so excited for you to be here. And for those who listen to my show, know even though I'm a Gen Xer, a proud Gen Xer, I love millennial culture and to talk about millennials. So, of course, I found the right millennial to have on the show because Kelly really, truly represents everything we love to talk about, which is transformation, using technology, transforming healthcare to a better place, and at the same time, reducing your personal cost of care, but also giving you better access to care. So I want to start, Kelly, by saying, tell us about what your role as Nurse Kelly for Wanderley does, because I know as a hospital CEO, the service you're providing, the technology platform, was so needed for so long for nurses that travel. Can you first explain what a traveling nurse is and then explain the platform you've created?
Definitely. So a travel nurse is a nurse that will basically go to a hospital that has a need. So whether it's a crisis need during flu season or just understaffed or someone's sick or out for maternity, whatever it may be, they need a need filled by a travel nurse. So we send other healthcare professionals as well, but they usually go to a specific hospital or facility for about 13 weeks. We have some year-long international assignments that we offer too, but it's very quick. We do, and basically how they do that is through agencies and companies like Wanderly, and the agency will gather all of their documentation, everything that they might need, make sure that they get a license in that state, because you have to have a nursing license obviously to work in that state, figure out the pay package, everything that they're going to need to pay rent and housing and stipends and things like that, all the ducks in a row, and then they send them out for the 13 weeks, and then they're done. They can work around holidays, they can do kind of whatever they would like with their schedule, which is really nice. And the old way of doing this was a nurse or a traveler would contact an agency, and then the agency would contact the hospital or have the jobs from the hospital, and they would figure it all out, and then they would send the traveler. Well, the nurses, I think that process was fine, but they really, really wanted to be able to compare pay packages for possibly even the exact same position from agency to agency to find the best one. Who's going to pay me the most? Where is this, who's going to be able to be flexible in this specific instance? So they wanted that comparison tool. And it's also kind of, before Wanderly, they also had got a lot of phone calls from different recruiters from different agencies that knew they were travelers. And there was a lot of kind of bombarding that occurred with the travelers. And so What we did was we took all of the agencies that we can that are our clients, and we put all of their pay packages on Wanderly. So nurses that are searching through filters can filter it down to exactly what they're looking for, and then they can compare who's offering what side by side and where they're offering it. And they can actually communicate with recruiters anonymously before giving their contact information. And we house all of their documentation, everything right then and there. So once they select a position, they don't have to keep re-uploading it to different agencies. We can send it out with their agency branded and send it to the agency and get it all set for them. So we're trying to just create this world of ease and efficiency when it comes to that by technology from the old process to kind of solve some of these pain points that travelers have expressed to us that they've been having, or frustrations. So that's what we do. I am the chief nurse advocate, so I obviously advocate for all of our nurses. I keep nursing at the forefront of everything that I do and making sure that it's respectful and that we're putting out content that they want to see and that's informative to them and important to them. And so I run our social media pretty much through that, but I'm just definitely kind of the nursing advocate. I handle all of the nursing inquiries that people may have. They can contact me directly, and I do a lot of social media stuff and kind of getting the word out, because I think that we are absolutely a solution that the people of travel nursing have been asking for.
So is it a safe and fair comparison for old people like me, Gen Xers and Boomers, to say, if you're not familiar with travel and staff nurses, to compare it probably to the travel agent of old, right? Where you used to call somebody or multiple people and see who'd give you the best deal. Now what Wanderly has done, and it's amazing that it took so long, but you guys did such a good job of it, is they put it all on a website, much like the travel industry, so you can shop and compare. And it's not just hourly rates, it's location, hospital, where's the housing. I was sharing with Kelly that when I ran 2 different hospitals in the city of Anaheim, most of my traveling nurses lived in Newport Beach. I mean, why not, particularly if it's paid for? But those are the type of things that are attractive to travel nurses. And you mentioned international. Kelly, do you guys ever place CEOs? Because I want to go over to Dubai in a few years. Can you make that happen for me?
Gosh, yes, and I'll go too. That sounds amazing. No, we haven't placed any CEOs, but you never know. At this point, we're growing so rapidly. Who knows what the next formation of this will be? But it's so true. And to touch on it too, our agencies are our clients. So it's not that I want to rag on them or anything like that. It's just the way that it's been being done. There's a more efficient way to do it. And we also have a lot of perks for our clients who are the agencies as well. I mean, they can share jobs directly out of our site. They don't have to type them up all the time. They can also create a really nice relationship with the traveler because they don't have to do anything, the dog and pony show, because the traveler is coming to them anonymously. And then when they get a traveler they want to submit to a hospital, they're fully profiled. We have everything that recruiter could possibly need. So I really do believe it's symbiotic for both the agencies and the travelers to have a solution like Wanderly, even though it's definitely very different than the old way of doing it, because nurses have a lot more transparency and can see pay packages side by side. But I think it's helpful
too, Kelly, but what industry hasn't? I mean, this is just Uber, right? For taxi drivers, right? I mean, it's what industry hasn't utilized technology to become more efficient? But and again, Wanderly is at the cream of the crop. They did it better and quicker than anybody else. And there is that uncomfortability from the agencies initially till they realize, well, this is the wave of the future, so I'm either in or out. And they'd be smart to get in. Hey guys, if you're in front of a computer or your phone where you want to look up Kelly. It's Kelley Johnson on LinkedIn. Kelley, Kelly Johnson on LinkedIn, Chief Nurse Advocate for Wanderly, which is Wanderly. Kelly's also on Twitter on the bird at Real Nurse Kelly, And Kelly, tell us about Wanderly's website, where they can find you, what folks can look to see on there.
Hey folks, it's Doug Sandler, host of the Turnkey Podcast and the Nice Guys on Business podcast, downloaded 3.5 million times in 175 plus countries. I wanted to make sure that you know that Dr. Josh Luke is not only a nationally recognized podcast host, but an award-winning futurist and one of the most engaging and funniest keynote speakers you could ever see at any type of event. Did you know that Dr. Luke founded a not-for-profit in honor of his mom to raise money for Alzheimer's? And when he speaks, proceeds go to that cause? Whether it's an association event, trade meeting, corporate meeting, or church, Dr. Luke is counting on you to reach out to your event planner today to keep his epic run going of being one of America's hottest up-and-coming keynote speakers. He will have you rolling in your seats with laughter and at the same time engage you with stories that help you live healthier and save thousands on healthcare. You can follow him daily on LinkedIn and Twitter and check out his speaking samples on his YouTube channel as well. And when he speaks, everyone in the audience gets a free copy of his most recent best-selling book. And who doesn't want to hear a futurist speak? In fact, the first 3 people to reach out to the show today to connect Dr. Luke to their association meeting planner will receive a free copy of his book. Reach out at info@spendlessonhealthcare.com. That's info@spendlessonhealthcare.com. Email today.
Yeah, definitely. It's wanderly.us. Actually, it's a .us platform, and you can go on as either the recruiter or the traveler. We have a recruiter platform, we have a traveler platform, but basically if you want to travel in healthcare, it's not just for nurses. We have a ton of other ultrasound techs, speech language pathologists, you name it, go on there and see. You'll be able to filter the search on the left-hand side. So maybe you want to go to San Diego for Christmas or whatever it may be. You can enter in all of your credentials and anything that you are specifically looking for, search the pay packages, create your profile and fill it out so that we have your information. And then when you're ready to be submitted, it's very, very quick. It's just one click and we can submit you through that recruiter or through an agency. If you have a recruiter and agency that you love and you want to work with, they're most likely on our platform and you can be submitted through that as well. And we'll house your documentation and you can still use the comparison tool to try to get more money or to, have more for housing or whatever it may be that you're interested in. We have that gives you a lot more of the control back as the healthcare professional. So that's kind of what you can expect. Our blog is of course on the website as well. And I am the main author for the blog, but we have a ton of incredible contributing authors. Cool. And then our podcast is housed on wanderly.us as well on the blog site.
Awesome.
Yeah.
Awesome. Hey, so folks, you might be saying, hey, tell us more about where traveling nurses in Wanderly fits into reducing overall healthcare costs. And we're going to transition into some of Kelly's personal accomplishments as we do that. But I wanted to point out, as a hospital CEO, the way I can reduce your personal and family healthcare spending is by being more efficient with how I pay for staff. And oftentimes at my hospitals, I wouldn't have a nurse that was credentialed in a certain tactic or required some sort of certification. So I would have to send you or your loved one over to a bigger tertiary hospital who might cost you twice as much, might be out of network. I might have to extend your length of stay for 3 or 4 days longer, and nobody wants to spend extra days in the hospital. So what Wanderly's done by really digitizing this and putting it online is really trickling down to the American business and the American consumer and saving a lot of dollars for you in the long run. So that's why I thought it would be important. One of the reasons I thought it would be important to have Kelly on the show. Another reason is Kelly is pursuing her PhD. She's not just a nurse. She's a nurse that wants to make a difference. She's also been very active on the pageant scene. Is that what it's called, Kelly? Pageants? Forgive me.
I guess, yeah, the pageant scene, that sounds good. I'm not really sure. I mean, that whole world was pretty new to me, but yeah, that sounds like a good word for it.
So tell us, let's start by your PhD. What do you plan to do with the PhD? And we'll come back to the social missions that you advocated so much for in your pageant years.
Yeah, so it's a doctorate in nursing, so it'll be a nurse practitioner. So I'll be in family for family nurse practitioners. So I can see my own patients, treat my own patients, I can prescribe medication, kind of all of that. But we do have, when you go from getting the master's, which is the NP, to getting the doctorate, there is that level of, I guess, of responsibility that you do take on for being a leader in the profession. So I'm very much looking forward to that. I definitely want to practice. I've always wanted to host medical television because I think it's really important to have a doctor of nursing when we have physicians and doctors of everything on these medical shows. We don't have nursing represented, and I would love to be able to do that as well, just for nursing, but also because I think that I have something intelligent to contribute to medical conversations and would like the opportunity to do that. So I'm not really sure exactly where it's going to take me, but I just know I love nursing. I know this is the field I want to be in. I'm not sure what capacity that will always look like, but I wanted to have the highest level of education I possibly could so that I could be an expert.
That's my answer too. I always said I just wanted to have the highest level of education and then get experience to back it up. Hey, when will you be done with that? Are you a year or two out? Or
I'm a year out. Yep, a year out from March. So
congrats. And what great timing too, because we're seeing the hospital to home. We're seeing in my most recent book, Health Wealth for You, 11 Steps to Save Big and Live Healthy. One of those steps is direct primary care, where somebody like Kelly could actually open her own practice, where she could limit the number of people and give you 20 minutes at a time. All those different tactics are really coming full circle. The personal family physician or nurse practitioner. I've found over the last few years, as I shifted to a cost sharing plan, that I actually preferred to go to the nurse practitioner before I had direct primary care in my area, because it was more accessible and I did get more personal focus from that. So I'll look forward to hearing where your career takes you once you get that degree, Kelly. But so let's talk about, here's the first question I have for you. How do you go from being Miss Colorado teen, I think, to Miss California?
So funny.
There's a lot of wisdom moving to the warm state, but tell me how you can do both.
For sure. Okay, so I actually was Miss Colorado. I was never a teen. I didn't grow up doing pageants. I was just one day there was a flyer and I saw the flyer and thought this would sound fun. They offered scholarship money and I had a lot of student debt. So I competed for Miss Colorado and won, which was so crazy to me. But that was for Miss America. So I did a nursing monologue as my talent, and that's what pretty much differentiates the competitions, is that Miss America is really heavily scholarship and volunteer based, and then they have the talent portion. And Miss USA is pretty much fitness, but swimsuit, evening gown, and then interviews. So they are very, very different. But when you go from one organization, so from Miss America to Miss USA, you can, as long as you live in that state and can prove residency, it wouldn't matter. I could have technically been, Miss Colorado, America, and USA as well if I'd wanted to compete that way. But I moved out to California to take this position, and so it just seemed like this would make sense. And I had residency here and I wasn't quite done yet. Pageant fever is a very real thing.
Good for you. Good for you. So tell me, did you ever actually work as a nurse, hands-on nurse?
Yep, I did. I was in the I was in the CVS ICU. So it was an incredible experience, very critical patients. But that was before I won Miss Colorado, and then took a lot of time off after that, because I'm not sure how familiar the audience. I'm not sure how familiar the audience is with all of that. But I was very, very busy after Miss America. I'm not sure if they're familiar with the whole
You're the road warrior for like 14 months or something, right?
I was on an airplane every 48 hours, if not even sooner, for a year, for sure.
Hey, folks, it's sponsor appreciation time. This is Dr. Josh Luke with the Spend Less on Healthcare podcast. And today, I want to remind you that not only do these organizations support our show, but they're products that I believe in. And I'm really excited today to tell you about healthy.com. That's HLTHE.com. Do you want free money for healthcare? Because that's what this is. Who doesn't? Have you heard me share from the stage or on the show that I partnered with an organization created just to provide financial relief to those who request it? Learn more at healthy.com. Just think GoFundMe, but with two added benefits. First, the money can only be used for healthcare. And second, unlike GoFundMe, the donations are tax deductible. That's right. On GoFundMe, the donations are not tax deductible. When donations are made in partnership with healthy.com, they are tax deductible. So here's how it works. Log on to healthy.com, that's HLTHE.com, and within 2 minutes, you can open a wallet and request funds by simply entering your name and email and phone. Within a few weeks, a debit card shows up in the mail. Funds are added to that card at no cost to you, and those funds can be used to pay your doctor, hospital, dentist, pharmacy, or any other qualified healthcare provider, just like if it was your healthcare savings account. It's that simple, really. And if you work for a company or have a family member who may want to make a donation to the site, that'd be awesome. It's these tax-deductible donations that make it possible for Healthy.com and its partners to load those debit cards with free money to be used to benefit those in need who have healthcare and medical bills that they can't afford. Guys, no strings attached. Register at Healthy.com. That's HLTHE.com. Take a few minutes and register for a wallet. Thanks for your support of the Spend Less on Healthcare show with Dr. Josh Luke. And you mentioned that at your first pageant, you took nursing on as your social issue, but you also mentioned to me off air that Alzheimer's, you kind of shared an Alzheimer's story. Can you share with us a little bit about that? Because most of our listeners know that my mom had a 9-year battle with Alzheimer's before she passed away earlier this year. And that's close to my heart. So can you share a little bit about that?
Yeah, and I'm so sorry for your loss. That is, so we're fighting Alzheimer's for sure. We have to continue that conversation. But yes, so when I was going to compete for Colorado, I didn't have a talent that they would necessarily have accepted. It was, I don't sing, I don't dance. I played sports my whole life growing up. And so I just thought to myself too, if I'm ever going to win, or if I ever actually won Miss Colorado or went on to be Miss America, I would have to do it 100% being authentically myself. And I was a nurse at the time, a brand new nurse. And that was all I could do. That's all I wanted to do was be a nurse. And so I wrote a monologue. That's awesome. Well, thank you. I thought it was a talent for sure, and I know how hard we work. So I wrote a monologue about a patient that I had who had Alzheimer's, because I thought too, if I'm going to do a speech or a monologue, I want it to also mean something to somebody. And nurses, we all very often say, oh, I'm just the nurse, or we say that to ourselves, or I can't help you with that because I'm just the nurse. And I always hated that in nursing school because I felt really important. And I felt really vital to the healthcare team. And so saying I'm just all the time, I was sick of it. So I wrote the monologue basically about an Alzheimer's patient who I really did take care of, who reminded me one day, looked me square in my eyes and just said, "You're not just a nurse, you're mine. And you've really made a difference in my life," kind of compliment, and to stop saying that sort of thing. And it was really crazy because, as I'm sure Alzheimer's has varying degrees of severity, but it was earlier on. But somebody who, mental cognition might not be the strongest suit at that point or character trait was telling me this. And it was just such a moment. So I wrote about that, and that's what I spoke on. And I think Alzheimer's means a lot to a lot of people and means different things to different people, but has touched almost all of us in one way or another. And so that was important for me to talk about. And then this idea of it not being okay to call someone or yourself just a nurse or just really anything, because that's not what we are, meant something to me. And then it went really, really viral. And the next thing you know, at 22 years old, I'm on Ellen and going on a 70 keynote public speaking tour over the next 4 years. I don't know. It just kind of happened.
So cool. Yeah, I get just a PhD quite a bit when I was working in the hospital place, but never from doctors, actually, never from MDs. They respected it. It was other folks that kind of went, oh. So, hey, I want to ask you about knowing that social missions, and you just gave a couple examples that were close to your heart. The one that's closest to my audience's heart is just how in the world we're going to afford health care moving forward. They've all heard the stat that more than 50% of a millennial's lifetime earnings will go to health care. My kids are Gen Z, and when I speak, I tell the story that when they come to me after college and say, hey, Dad, health insurance? Yeah, I'm not interested. I think that'll show wisdom, and I can't argue with it, right? Because it's so, there's hyperinflation that just never ends. So can you just share with us from your experiences, both just as a nurse, seeing people that look, it's bad enough that you have anxiety when you go to the hospital and you worked in a critical care unit, but knowing that the cost of a critical care unit is $4,000 or $5,000, $6,000 a day at a minimum. Tell me your experience being a millennial, working in the industry, and just being such a social advocate. Where do we go from here with healthcare affordability?
Oh, it's such a good question. Of course, throughout my pageant years, we would be getting asked about the Affordable Care Act all the time. And I always just said kind of the same thing. And this is just my personal opinion.
It's a political trap. Be careful.
Yeah, I know, right? They always would ask us that. And I always had the same answer. And it felt pretty neutral because I wasn't healthcare that I could speak on it. But I just would always say universal healthcare, this idea that everybody could be covered and have insurance, is a fantastic idea. But it's really difficult now, especially now that I'm being in the provider's shoes. We have so many people now that have insurance as well. We don't have enough people to take care of them. And I think that's one of the challenges we face. But to go directly into cost, what's crazy is I was thinking about this as we were chatting, and I actually pay more for healthcare that I'm mandated to have through my school getting my doctorate than I do in tuition every single semester. I pay more than I pay for my car payment in every single month for it, and I don't even really need to use it. I also have such a fear of getting in an accident or something, or needing healthcare and being out of network because it is so expensive. I keep my insurance card with me on the back of my cell phone. I mean, this is just insanity if you ask me. I think that's all very crazy, but This is just another example. I went to the dentist, yearly dentist or whatever, 6 months, whatever it is. And I hadn't had x-rays in a very long time. So very natural thing, people go to the dentist and they get x-rays. I've had insurance I have dental insurance, the whole thing. I go in, I get a cleaning, I get these x-rays, and the x-rays, even though I haven't had them in the allotted amount of time that you're supposed to have them, like by a medical professional that tells you to look for the health of your teeth, we're still not covered. So even after the dentist, just getting x-rays and a cleaning, I owed $100. And I just thought that was crazy. So I'm not sure if I have any real, really substantial, I guess, examples to offer you, but I've definitely, with how much I pay for school, it's more than I pay for school to just have health insurance that I don't really need to use that often. I'm definitely, my medications either have to be very specifically the generic form or the brand form. It's very specific, which is also very expensive. And then, just even having insurance, the cost is still so expensive for something that I am told by medical professionals I need for my health. And that's just crazy.
So Kelly just talked about the cost of pharmaceuticals, and there's so many different products that we've covered. GoodRx.com is one where you can go shop. There's 3 or 4 others. Kelly, I want to put you on the spot a little bit and ask about any applications, mobile apps that you use to manage your health, or even any devices like an Apple Watch or a step counter. And before you answer that, I'll give you time to think about it here. Health Wealth for You, 11 Steps to Save Big and Live Healthy, has a whole chapter on women's health and 5 or 6 apps to help manage women's health. Has a chapter on behavioral health, anxiety, and stress management. Has all those apps, whether it's Calm or something else. We talk about Fitbits. We talk about the Apple Watch. Talk a lot about a technology. So as a millennial living in in Los Angeles area where you have access to pretty much any of these that you want, are there any that you use every day that would fit into that category?
I will be completely honest with you. No, there are not. And here's why. I have a reason. I don't use
send
any.
You a copy of my book.
Yeah, no, please do. Well, and so it's funny too, is the ones I would for sure use would be like sleep counters and like helping you fall asleep. That sounds like amazing. I love meditation, love yoga. I go out and I do active classes. I do cycling and yoga and all these things through an app called ClassPass, which is actually.
Well, there you go. That's one of them.
Yeah, so I feel like that counts. The thing with the step counters though, and like the calorie things like that, and like tracking what you eat, for me, being in a world for 4 years of comparison of women and especially when we have an aspect of competition, that's how we look in our bodies.
Sure.
I never wanted to go to an unhealthy place, so I just avoided that completely. But I do believe in the power that it has to help people keep track and to be healthy.
It seems to be more and more the norm, though, right?
I think so too. Yeah, I mean, I think people love it. I definitely do. I think that they definitely serve their place. Just at the time, I was on a very specific nutritional regimen and working out and all of that, so there was just not time to keep counting. I'm also not someone who can like sit at home and like enter in stuff. And I also, with the step trackers too, I would be the one that like would go for an extra walk to like make sure I hit the 10,000 every day, which is again not a bad thing. But I work out plenty, so it just kind of became an obsession more than it did something that was actually like really I needed to be doing. So that is one thing.
Can I just tell you, my buddy used to just put it on his dog for about an hour a day, and his dog ran around the backyard.
So funny.
People get credit for it.
It's so funny. Well, yeah, and so that's kind of it. Like I make sure I go to my routine workouts every single week. I don't like to miss any time at all. But no, I don't actually keep anything like to count it because I just wouldn't do it. I just know myself. But the apps that help you go to sleep and things like that, I think those are wonderful.
Cool. So guys, we're going to come full circle. So we started with Wanderly and how traveling nurses and having an online portal to take care of all their needs is revolutionary and is really starting to save businesses on healthcare costs as well as individuals. We talked a little bit about Kelly's social missions and how her advocacy for Alzheimer's and for just healthcare affordability is something that's close to her heart. And so what I want to bring it back to is if you are a nurse and you're listening, because I know Kelly's got a huge following on social media and on her podcast. And Kelly, tell us the name of your podcast and where they can find it.
Yeah, it's called The Happy Traveler, and you can definitely get it anywhere that you go to for your podcast. I know it's on Apple iTunes, and I think does Spotify have, I should know this, the last one. I think it's Spotify or something like that, but there, anywhere you Google, look it up for podcasts, it's there.
Yeah, so if you're a nurse and you are just learning about Nurse Kelly, check out the Happy Traveler podcast. Follow her on LinkedIn. Remember, that's EY, Kelly Johnson. On the Bird Twitter at Real Nurse Kelly. But if you're a nurse also, we talked about this a little bit previously, Kelly, but tell me where, so I founded the National Readmission Prevention Collaborative. It's a not-for-profit. I founded it as I was writing the book on readmission prevention, the first book after the Affordable Care Act introduced that concept. Tell me, so if you are a nurse, by the way, we have 3 different classes you can sign up for. They're all online for CEU contact hours for your licensure. Go to nationalreadmissionprevention.com if you're interested in that. I'm trying to think of everything that I can value add for nurses since you have such a great nurse following before I forget. So yeah, just go to nationalreadmissionprevention.com or just go to my LinkedIn and message me and you can learn more. But those are all online. You can have certificates for 4 hours by tonight if you need them, but they're on readmission prevention, bundled payments, and transitional care. We also have certifications in each of those things. So Kelly, how often do you get your clients talking about readmission prevention or nurses that are experienced in transitional care or bundled payments? I imagine it doesn't come up a ton, but it must come up from time to time. And what are the specific aspects of readmission prevention that seem to be of interest to people?
Sure. That's actually a really good question. For me, at least personally, that kind of goes back to when I was practicing by the bedside, because that's a huge conversation that we have a lot.
Sure.
And to be really honest, and to be really honest with you, a lot of those conversations surrounded infection control. A lot of those conversations surrounded, quality nursing care that helped keep people clean, because people would be readmitted a lot of the time for something like a UTI or an infection that came, once they got home, or a super infection that came from something with antibiotics or something like that. And so that's kind of how, or a fall, something like that for like someone who is elderly. So a lot of those conversations for us surrounded quality infection control, quality nursing care, and then fall prevention. To be honest with you, I don't have a ton of experience with, readmission prevention, but I know for a fact that it's a huge, huge hospital initiative at every single facility that you're going to find, because that just costs so much more money.
And do you guys place nurses in post-acute nursing homes or home health or outside of the acute hospital at all?
Yes, there are definitely positions in home health.
Yeah, so that, guys, is a huge growing need as the Affordable Care Act pushes value-based care, pushes hospital care into the home, encourages self-management with all the technology and innovation we've been talking about. Look, even if you're not a nurse, if you're in post-acute or anywhere in healthcare, I would encourage you to go to our not-for-profit website at nationalreadmissionprevention.com. We have certifications in readmission prevention, bundled care, home care, in transitional care. And when you finish them, Kelly, it's really cool. In fact, Kelly, I'll send one to you if you're interested in it. You get a little seal of completion that says, hey, I'm a certified readmission prevention fellow from the National Readmission Prevention Collaborative. It is an awesome conversation starter. And I never actually really thought about it in staffing, because it's mostly the post-acute providers that are like, oh man, everybody loves to talk about this certification. Mm-hmm. It makes me stand out. It's on my email signature, all these different things. So if that's of interest to you, check it out. Hey, Kelly, we've got just a couple minutes left here. And you mentioned earlier that you grew up an athlete. I'm gonna take 2 guesses: soccer and volleyball.
Volleyball, never soccer, but that's really funny. My best friend in the world played soccer, so we were at soccer games quite often.
Okay, there you go. Yeah. There you go. And so when we sign off, we normally ask you, what is your favorite sports team to root for, whether college or pro, and why? And I'm guessing it's going to be somewhere between Denver and Southern California.
You chose correctly. That's so funny. I think for sure it's an easy answer to say the Broncos, because Peyton Manning helped us win the Super Bowl the year that I was Miss Colorado.
Oh, there you go.
So I obviously know he's retired, but I'm just saying that's never going to be a memory that will be easily forgotten.
That's
that was
cool.
A very cool year. And then the Dodgers, my dad passed away when I was little, and he was a huge LA Dodgers fan, was watching them the day that I was born. And so I've just kind of taken that on too. And they've obviously been very successful in recent years, which has been really fun.
So now all of my listeners think this entire interview was a setup. So what Kelly does not know about me is not only am I a Dodger fan, but I host a second podcast with a former Dodger player.
So cool. I did not know that. I really didn't.
Called the Dodger Dudes. So, and by the way, my favorite NFL team until the Rams moved back to town was the Broncos. I was a huge Bronco fan growing up. So random. So we have lots of notes to compare. Kelly, this has been an awesome first show of Spend Less on Healthcare. I think you did a really good job of giving some anecdotes on how important this healthcare affordability issue is for the millennial and then the Gen Z generation, and also how your company, Wanderly, is playing a role in reducing those costs for businesses and individual families by helping me as a hospital CEO or even a home health agency, as you said, better control our costs so those costs aren't passed on. Can you, in our last 60 seconds here, just share all the information you want to share about how to track you down, get a hold of you, and learn more about what you're doing?
Yes, absolutely. Thank you so much for having me. First of all, this was really nice. Anyone can find me on social media. I'm across all platforms is at Real Nurse Kelly. And it's very important. Kelly is with an EY. So Real Nurse Kelly. You can find Wanderly at wanderly.us. We would love to have you on there. If you want to email me directly, you're more than welcome to. It's Kelly with an EY at wanderly.us. That's my direct contact. I don't mind giving that out. I love to help at all costs and all times. So don't hesitate to reach out. But yeah, please follow me because I would love to continue this conversation as well. And obviously, I love meeting new nurses and other healthcare professionals, and I love discussing healthcare. So I am an open book. Feel free to ask me anything. And yeah, thank you so much for having me on.
Yeah, anytime. It was fun. And in case you weren't paying attention, folks, one of the things we learned about Kelly is that if you email her during her spin class, she is a creature of habit and will be there every week at the same time. So she'll get back to you within the hour, right?
That is very true. That is very true.
All right, Kelly, thanks so much for spending time with us, and we'll look forward to catching up with you again soon.
Sounds good. Thank you for having me.
Anytime. So here we are. We've reached the end of the road for this excellent episode. Make sure that you follow our guests on social media and check out our prior episodes as well. You can find them at drjoshluke.com. You already heard our offer for a free copy of 10 tips to start saving on healthcare today. In addition, when you text that number, we're going to respond with a promo code that gets you a copy of the award-winning personal health spending reduction tool for just $49 instead of $79. This personal healthcare reduction spending tool guarantees you and your family will save at least $1,000 in the initial 90 days after completing the assessment, and more, even more than $5,000 in the first year. This is guaranteed for you and your family to save that much money in year one. This is a not-for-profit, folks, and we did this for you. We partnered with all these resources because this is what what we're trying to do is just to help you learn how to spend less on healthcare. So again, to receive the free gift and discount, it's really simple. Just text the word Josh, Josh, to 72,000 and get your 10 tips list and a discount code at no charge. Last but not least, my speaking schedule for the upcoming year is almost filled up. So if you have an upcoming event you'd like to recommend me for, or if you work in the healthcare industry and your company could use a coaching session or maybe utilize the Selling to Hospitals Masterclass, reach out to me today at info@spendlessonhealthcare.com. That's just like the name of the podcast. It's info, I-N-F-O, @spendlessonhealthcare.com.
You've been listening to the nationally recognized healthcare podcast, Spend Less on Healthcare with Dr. Josh Luke, where you get simple tips to reduce the amount of money you and your family spend on healthcare. For more information on any of the tips, products, promotions, solution providers, or guests featured on this episode, email info@spendlessonhealthcare.com. That's INFO @spendlessonhealthcare.com. For additional episodes and information on the host, visit drjoshluke.com. That's drjoshluke.com.